Hello and welcome to the Federal. You're watching our program Off the Beaten Track, and I am Nilanjan Mukhopadhyay. It is often said that we should never forget what happens in our lives, especially when it is part of our collective memory. It is just barely few years, but it almost appears to everyone that COVID never happened in this country. But possibly it's very important to remember, at least in our generation, people who have actually seen through it, for the number of years that we live, to never forget those, terrible, challenge-filled months for various reasons. For many people have lost their families and friends, innumerable of them. Even I have personally lost a large number of very close friends and associates with whom I spent several decades, and various other reasons also. There is another very important reason why we cannot forget COVID, the entire pandemic, for the complete failure of the Indian state in being able to respond to the situation, not being able to take care of its people, especially the poorest. They were the ones who were hit the hardest, and they have not been able to recover and come and stage a comeback as far as their personal economies is concerned. I'm going to be talking about all these things, and I'm going to be talking to Mr. Harsh Mander, one of India's foremost public intellectuals and dedicated social justice and human rights activists. Harsh Mander is not a stranger to Indian public life. For more than 2 decades, he's had a very large social presence in India, primarily because of his activism, which started after he resigned from the Indian Administrative Service immediately after the 2002 Gujarat riots. It actually shook him so badly that he felt that he could not be any longer part of a system which had completely failed and participated in the massacre of its own people. For the last 2 decades and a few more years, he has actually shown light on how Indian public should behave. He's actually mirrored the collective conscience, the ideal collective conscience of a large number of people. So first of all, welcome to the program, Harsh Mander. And the reason why I'm speaking with you is that you have come out with a new book, another of your several books. This one is called Burning Pies, Mass Graves, and a State That Failed Its People, India's COVID Tragedy. First of all, congratulations on this book. Possibly a very timely reminder. We cannot forget that in this country, politics can never be delinked completely from Indian society. Next year is going to be India's parliamentary elections, which many feel will be possibly one of the most crucial elections this country has ever seen since independence. Book comes out in this particular backdrop. Let me ask you with a very elementary question. Why this book at this time? What made you write? After all, you had documented during the first wave, and part of it had already come out in a previous book. You added several chapters to it, several portions to it, a second part to it, to give it a slightly more depth than just what you saw during the initial months. So I'd like to hear from you your reasons for coming out with the book at this time.
I start, it's wonderful to be with you, Nilanjan. I have great respect for your contributions to India's journalism and public discourse.
Thank you.
Why did I write this book? I start my book actually by trying to explain that there are 3 reasons that I write this book. And the first of them is that we must remember, we must not allow ourselves to be immersed in a kind of enforced amnesia that I see around us. First of all, we must remember to be able to grieve that every life lost was a life of value. And, we have a government which is even denying the numbers They talk about 500,000 lives. Experts believe that is something closer to 5 million lives. But that each one of those lives, the bodies that floated, in the rivers, the bodies that were cremated or buried without anyone to mourn around them. And we must first grieve for each life lost, because each life lost was of deep value. And to affirm this. And I lost my own father during that period, and we hadn't been able to even gather his friends and people who loved and respected him. And that was the story, I think, of families all across the country. We lost our doctor who worked with homeless people.
Yes.
We lost beautiful people, and we must stop now, whatever we're doing, and remember and recall. That is one.
Right.
But the other reason that I wrote the book is that after grieving, we must have a place for rage, for anger, for social anger. We must remember, because a great part of the lives that were lost and the suffering that was unleashed, with 30 million people, migrants walking the streets, hundreds of kilometers,
Yes.
the family, I mean, the people who died choking for oxygen outside hospital, wards, the parks and street pavements full of bodies burning, all of that was not primarily the outcome of the virus. It was the outcome of a state that profoundly failed its in many different ways. And you talked about the first phase and why after the second wave I felt a much more comprehensive book was required.
Right.
Because the first phase, showed us a government that came down with the most punishing and the largest lockdown that the world has ever seen, and I hope will ever see again. And to have a lockdown of the entire economy in a country where 9 out of 10 workers are informal workers,
Right.
and actually eat what they have the next day, and to have virtually no relief package for them, it reflected a kind of what I called an almost pathological absence of public compassion among those who rule and govern us. And the cruelty with which it was enforced, people were not allowed to travel, the migrants and their tragedies. And I spoke a lot of that from a first person witness account, because I had decided that I won't obey any lockdown.
Yes, you were actually out on the streets documenting it and trying to help people in whichever manner.
People as much as we could. And but then when the second wave came, I saw a different face of the state, a state which actually was almost absent, from that almost crushed its people. And in the second wave, it was almost absent. And where was the state when people were choking for oxygen? Where was the state when people should have been vaccinated in massive numbers in preparation? They needed hospital beds. They needed
May I add just one sentence? Where was the state when election campaigning was being conducted by every party, including the ruling party of the Prime Minister, and he personally was campaigning in meetings after meeting, even though the pandemic had assumed, very large proportions in West Bengal, where elections were due. By the time second wave really picked up, voting was over in the other states, but West Bengal was very much a time bomb, and during that time campaigning was going on.
You're completely right. You know what our government revealed, our ruling establishment revealed what was important for them. The saving of possibly millions of lives and the suffering and the and the prevention of suffering. And we were showing ways very early. If you're locking down people,
Right.
those of us in the formal sector were getting our salaries or wages sitting at home. Minimum wages should have been paid to every worker. With Prabhat Patnaik and Jayati Ghosh, we calculated that it would just have cost 3% of the GDP, which we should have spent. Uh, so instead of worrying about all of this, you showed that even at that time, uh, the narcissism as well. I remember the first wave, the prime minister actually thought it fit to be posing with peacocks and ducks in his garden, and then you were toppling governments, buying MLAs, fighting elections, everything, uh, and and also the entire extraordinary campaign where people were persuaded, within a week of the first lockdown, that one religious community was responsible uh,
Right.
for all of this was what the government was preoccupied with. And when its failures became more and more manifest after the second wave, the preoccupation was actually to run uh, incredible, unprecedented campaigns of "Thank you, Modi,"
Right.
overnight in every government building, every wall, every poster, for thanking Mr. Modi for doing his duty and ultimately providing us vaccines,
Which was also not done properly.
which was all,
If I may.
which was a spectacular failure, which made it worse.
In fact, I remember that some of the things which were actually, initiated by him possibly ended up making us look ridiculous on the international plane. Just imagine, asking millions and millions of people to beat their plates
Yeah,
outside, as a mark of respect for Corona warriors, creating all kinds of jargon somehow or the other to try to promote,
yeah.
his own party's electoral narrative.
When I was traveling abroad some time after this, you had to show your COVID
Right.
certificate, vaccination certificate, and it has a picture of Mr. Modi.
That's right.
And they'd say, no, no, that doesn't look like you. No, it's not meant to look like me. It's my prime minister. And they'd laugh and they'd say, there's no country in the world which has the prime minister's picture on your vaccination certificate. So it was, all of this was, it could have been, laughable, except that it resulted in the greatest humanitarian crisis that we have seen, probably after
Right.
partition, its riots, and
Never before had there been such a public health, crisis in India.
not just see, Nilanjan, what I want to underline is that the public health crisis was there, but the way we handled it created a whole set of other crises. So
So,
you had a
yeah,
hunger
it,
crisis.
it led to a lot of other crises. Now, let me ask you a slightly more, moving away from COVID management.
Right.
Why do you think that the government acted the way it did? Everybody knows that that was no way for the government to act. No government in its senses would possibly impose within, giving a notice of 3 hours for the kind of lockdown which happened. So people started walking out. I stay very close to an interstate bus terminal, so I know that how the people started rushing out and trying to board it, and somehow or the other even hanging on to the coattails of each other, to put it very figuratively. That's the way people just ran away, whatever was there. But even then, the buses had stopped.
Arundhati Roy, sometimes captures very beautifully, the question of why did the government act in this way. She said
Mhm.
COVID-19 is a virus, but it is also an X-ray that reveals in all its darkness what kind of society we've built and what kind of government we have. And I think it is that, and I hope we get a moment to also talk about what it revealed about our society. But let me first speak about the government.
Hmm.
And uh, what the government made totally clear, amply clear, was that there were some lives that are important and that need to be protected, and millions of other lives which are entirely dispensable. So if you have a program where you ask to Okay, work from home, I said, 9 out of 10 people are informal workers and would not get a salary. You haven't had any plans for them. You're told to keep social distance. 6 out of 10 Indians live in one room or less. How is it possible for them to keep any kind of distance at all?
Right.
And when we started distributing food on the streets, I mean, these are memories I'll carry to my last day, where you gather there and sometimes 5,000 people, 10,000 people pushing and rushing against each other, desperate and reduced to this indignity of wanting a little,
A small
label of
morsel of food.
food. This is what we did to our people. So I think that the complete absence of and on the other hand, you had the people who thought they were benefiting from this, which was the middle and rich classes, uh, were happy to bang thalis. I mean, when we were told to stand on your balconies and bang thalis, one thing that again struck me: what about people who don't have balconies? And what about people who have no homes? I
Right.
mean, so they were never part of the government's agenda at all. There was something else. Secondly, I thought that the government made it very clear that it was, even at this period, it was defending private profit. I mean, the whole vaccination crisis, why were two private firms picked up? We will never know why they were picked up. We had large number of public sector institutions. We could have gone in for compulsory licensing and actually produced vaccines well in time, enough for every Indian. The second wave could have been prevented,
Right.
and perhaps countries in Africa would have benefited from it. We didn't do that. But I'd like to also say something, Nilanjan, is that while we while all of this was created by policy choices of the state, contrary to any kind of understanding of what happens in a country of such great inequality and poverty. Uh, and contrary also to a great deal of technical opinion. But what I think we must remember, and one of the reasons that I wrote this book, is it was also the cumulative outcome of policy choices that have been made by successive generations or successive governments, including those of the past. And we have one of the most privatized healthcare systems in the world.
That's right.
We spend just a little over 1% of GDP on public health, where we should have spending at least 3%, if not more. And even what we are spending, a lot of it is on super tertiary centers like All India Institute or on health insurance premium, and not for strengthening primary health care services. It was one factoid which I discovered while I was working on this book, and even though I thought I knew enough about it, 8 out of 10 doctors in India, trained doctors, and this is after a huge number leave and go to North America and Australia and Europe. Among those left, 8 out of 10 workers in India, doctors in India,
Doctors.
doctors in India work for the private sector. Only 2 out of 10 work for public health systems. And when you think about it, how can just 2 doctors, out of 10, how will you operate? How will you deal with the century's biggest health
Yes.
crisis?
You
And
know,
and they were they were.
this is a point, which has been pointed out to people within the government, and as journalists, we have also pointed it out to various people who advocate the government position in public.
Right.
They say that, look, these have been, remnants of the past system, and you cannot expect this government to do everything within a span of few years. But more importantly, they say that one of the reasons as to why there was initially, such several wrong decisions were made. They do in private, several of them accept that lockdown was possibly not the wisest thing, but they put it this way: that look, after the first experience, the government decided that they shall never be a lockdown, and Mr. Modi has never imposed lockdown after the what happened during the first phase. So they say that there was actually no past experience, that there was no way that they could have learned from history as to how to tackle such, a pandemic of this nature. Spanish flu, it was a different era, different government, different people, different kind of administration, completely different. They say that only hit and trial could have worked. That is actually somebody who explained to me, and that, look, that is what we did. And the moment we were able to understand that the hit was wrong, we changed the tack, and immediately we were eventually able to find the right way out. That's what they did.
Nilanjan, I wish I could be persuaded by this argument. I mean, as somebody, I've been part of public system.
Yes, you are. So you have been part of government. You worked in the Indian
and I
Administrative
know,
Service.
I know what it could have done. I mean, and in fact, I've written extensively about what I thought the government should have done. So just let me argue that it required no kind of foresight. It required a sensitivity to how millions of poor people spend their lives in this country. All that was all that it required. I think that the first thing the government, even given the fact that it had inherited this kind of very unequal health system, it should have nationalized the public health system for the duration of that. That was an elementary thing. It doesn't require that every doctor, nurse, trained health personnel, every hospital bed in the country is a public facility.
Public servant.
You start with that. And everything would have been different. I mean, when government kept saying we're creating new beds, what was it doing? It was actually taking away the few beds that existed for cancer or for dialysis or for a range of other illnesses, for safe delivery of babies. All of that was diverted because you just had those 2 out of 10 doctors in the public who were available to the public system. So that was one thing that I. Secondly, even if they had felt that a lockdown was inadvisably, they felt that lockdown was necessary. My point is that think of the nine out of 10 workers who would not be able to eat the next day. You didn't need some great kind of hit and trial foresight. It just needed most elementary, what I call public compassion. And for that, if we had given the equivalent of minimum wages to every family in the country, about 7,000 rupees to every family per month, it would have cost us 3% of the GDP. It would have saved us actually a much larger contraction of the economy. Workers would not have had to migrate, in millions, and suffer and die in the way that they did. These are not things that they needed to learn with hit and trial. And you have to see the example of countries which have performed much better around the world. South Korea, for instance, chose to have no lockdown. It just did extensive testing. Every bus station, every metro station, every corner of the street, and you had testing. You then localized the affected population and supported them extensively. Just a little bit of an anecdote. I work with homeless people, so I was very concerned about what other countries were doing. And I asked my friends in London, for instance, and I said, what's happening to homeless people there? And they said, they have actually hired every hotel room from 7-star downwards. And the government has hired them, and they are housing in them every homeless person. So the hotel industry is being protected through all of this, and every homeless person is having a roof.
Somebody is paying for it. The government is paying.
And it's a right-wing government which still actually just displayed some degree of concern. And one more, argument that, okay, you made all of these mistakes. What have you done next? Have we sat down and said, now let us invest hugely in the public health system?
In fact, that is very important at this stage, to say that we had COVID very badly handled. They did not learn enough lessons after the first wave. They started beating the drum that Mr. Modi has escorted us out of this big crisis. Then the second wave happened. Elections continued through it. Several thousands of hundreds of thousands of people died in the second wave. We really have no estimates. And then we came out with it. The virus got contained. Maybe we started developing immunity
It was Malthusian, I think, how we finally,
Yes,
just enough people got infected, and therefore we.
yes. In fact, many people, never had, COVID per se, but they had all the symptoms of it, and even when they got tested, they were negative. But there is still a very strong suspicion that many more people would have, also tested positive, or at least contracted the virus in some form or the other, which never got detected. But now what?
Now,
Now what? As somebody who's handled it, we have to. What kind of policy and what kind of structural changes have to be made? Do you think?
and Nilanjan, I mean, so one was that at least at last, let us learn that we have to invest huge amounts of public resources in a primary healthcare system, in public health, with the greatest stress on the primary healthcare system. Most cities actually have no primary healthcare uh, infrastructure at all. Why, with all its limitations, why is the Mohalla clinic in Delhi so important? Is because it's the first time we have something resembling a primary healthcare system of any kind. The other thing that I wanted to underline among the huge big lessons from the pandemic, and what I hope we learned from it, was how spectacularly unprotected our workers are, how they have no
Right.
rights, no station of any kind. Prabhat Patnaik, Jayati Ghosh and I, when we wrote saying that give the equivalent of minimum wages, we actually discussed among ourselves that in rural India, that would have been easier to do because of NREGA, we have actually a registration of every worker and their bank details. In the city, actually, we have none. If we decided to do it, how would we have done it? We don't even have a record of who is working here, who are the workers, where have they come?
Right.
Because and really, in the end, we said perhaps if the government had gone through it, it would have probably had to do something like the election where you put a mark here. So this month we're giving 7,000 rupees, we're putting a mark on your finger, and next month you go. I mean, it had reached that level of, and it was a reminder of how, again, culpably unprotected our workers are. And that should have been the second lesson that we learned. I mean, public health, and if we were paying attention to the poor, that was the first lesson. And the second would have been to restore a regime of labor protection. But what did we do? Government after government, and this is also some non-BJP governments, state governments, actually dismantled whatever little protections or existed so far
Existing.
for workers, were even further dismantled. So and you're talking about learning lessons. And I just want to take you back to the Bombay plague of 1892-93.
Right.
And there was a colonial administration. And you know what the colonial administrator wrote somewhere? He said that if to prevent something like the Bombay plague again, we have to ensure for every resident of every city just two things that come completely free. And what are these? He said clean air and clean water. I mean, if you think this is a colonial administrator who said this,
That has still not yet been done so far.
we've done the very reverse. In in the Bombay plague, we actually had the accounts of it. Nirala, the great Hindi
The
literature
poet.
poet, he actually has written about his own family, including his wife, and
Yes,
they talked about bodies floating in the Ganga.
exactly. The same thing happened again.
And we are repeating it a century later. So I think that my fervent, almost desperate desire is that we remember, so that I said we have to grieve, we have to rage, and we have to build back better. And we can only build back better if we are willing to acknowledge what happened. The government has already said no migrant was without food. No one had no absence of died because of oxygen. The number of deaths is very small. If you're in this kind of denial, then we are just refusing to learn. My publisher, I mean, sometimes I was feeling so heartbroken. My editor, Ravi, said he's convinced that a generation later, maybe 30 years later, people will pick up this book to try to understand what happened so that we can prevent it again. But our people today would do that.
No, I'm sure that a book like that is going to be very valuable for future generations to come, and it is going to be, referred. There is one last question which I want to ask. We can keep on talking about this for a much longer period of time, but for reasons of paucity of time, I'll have to ask this question, which have actually perplexed me, because my area, as you know, has essentially been on writing on Indian politics and tracking the rise and growth of Indian political parties and various ideologies in India, especially the Indian right-wing politics. That is what I have tracked very closely. Despite what we are saying, a conclusion that the government did not act in the way it should have, with the kind of compassion which was necessary in the circumstances, to be able to have the foresight, to be able to manage such a crisis.
Right.
Despite that, it is not electorally penalized by the Indian public. I want to understand, have you been able to understand as to why this has not happened so far?
It's a profound question. It really needs to, we need to...
Very deep deliberation is required.
I have two sort of early answers.
Yes.
One of them is that as a society, because our politics represents a society, I believe that the Indian middle class and the rich class of Indian people are among the most uncaring in the world. I think our willingness to, our comfort with inequality and suffering around us is spectacular. I say somewhere in the book, it sounds like when 30 million migrants were walking the streets in the hot sun and dying, a crisis was sort of, an uproar was raised because in Kota, some students were trapped, who had gone there coaching. The government arranged beautiful buses safely to take them back. I was saying that, is it a dream that could I have had one student who said, I refuse to enter this bus until you provide the same to people largely would have been his own age, who are migrants, who are walking along hundreds of kilometers. I demand that what protection is being given to me is given to every person. I think as a society, it's unthinkable that we do this. And why is it so unthinkable? And our politics only reflects, when I talk about the utter indispensability of the utter dispensability of the lives of the poor don't matter. They don't matter to us, people of relative privilege. They don't matter to the political system at large. And I think there can be no other explanation as well. The other quick explanation is that with this particular government, they have sort of caught us into the politics of hate is like a drug. I just say,
to which they are addicted, to which they have got the people addicted to.
Not just addicted. Time magazine had carried a very detailed story during the migrant, where they took one man and they followed his whole travels, and it's beautifully written. But at the end of it, they asked him, after all of this, who are you going to vote for? And he said, of course, Modi ji. After all of this. And then they interviewed me, and they end with that interview where they asked me, how do you explain this? And I said, the only explanation that I have is that this government has succeeded in injecting into the veins of our society a drug that is so potent, and that drug is called hate, that intoxicated with this drug, everything is acceptable to me. Hunger is acceptable to me. 30 million people, the largest distress displacement incidentally in human history happens. It doesn't matter. It doesn't matter to me. It doesn't matter to my political elected representatives. I think that the same mirror that our failure to outrage, our failure to grieve, our failure to outrage reflects most of all who we are and what we are as a people.
That's a very sad way of saying, that the way you concluded it. While you were talking about the Indian middle class, I got reminded of what Mrinal Sen, the filmmaker, once said. I began my career in journalism with an interview with him, and then I was lucky to have met him a couple of more times. So he had this favorite line where he used to talk or disparage the middle classes. A large number of his films were actually very critical of middle class morality and their political stands, positions which they took. He said that the Indian middle class hate the poor and want to be rich.
I
That is
cannot,
something very.
I'm sadly cannot, I think it's a profoundly sort of
I
true.
suddenly got reminded of that while
Yeah,
listening to you. It was.
But before we close, I did want to also say that what still gives me hope is that there were wonderful people from
Of
the
course,
Middle East who were on the streets.
your doctor colleague, who did so much.
Yeah, and there were people from the middle class who was quietly distributing food when the migrants were
Right.
walking. I used to just watch, they would come in cars full of food, distribute it, quietly go away, come back again, distribute it. People in the second wave who were, giving oxygen, the oxygen langars by the Gurdwara. I read this, people who were doing cremations and burials of people of the other faith. I read of this young boy who lost his father. He was class 12 because he didn't have enough oxygen. And from the next morning, he was sitting, he created a helpline on his phone and he started organizing oxygen. And he saved maybe some 500, 1,000 lives. As long as we have, this much smaller number of people who show and display kindness, we'll still survive.
Well, thank you very much, for shining the light on the darkness that was there during the COVID period, and also showing us, a ray of hope by narrating stories like about your doctor colleague who spent so much of time and himself eventually, died because of COVID, and this little boy, the 12th class year boy. So they are the citizens of the future, and they carry the hopes on their shoulders and in their vision. Thank you very much, Harsh Mander, for coming and talking to us. It's really been wonderful. And once again, congratulations on this very important book. And I wish it all the success. And I would tell the viewers to please go and get a copy of this book. Thank you very much.
Thank you so much, Nilanjan.
Subscribe to the Federal's YouTube page for more news and updates.